The viewpoint of the renal patients of Ghana.
No one else but you.
A pivotal intervention announced by the National Health Insurance Authority this 1st of June, offering some support and relief. I'd like to dedicate this program to the late Priscilla Asante. Joy News spoke to her, 15-year-old. She made a passionate plea, but unfortunately passed on, I think, close to 48 hours after that interview. But now, her plea is manifest in a response. About 13.3% of the Ghanaian population suffer from chronic kidney disease. If it advances, one of the key interventions is dialysis. There are two types of dialysis, and there's been a lot of talk about dialysis. In the studio with me today, I have Mr. Kojo Bafo Ahinkra. He's the president of the Ghana Renal Patients Association, himself affected by the condition. And on Zoom, I have Thomas Khan, a dialysis patient and a member of the association in Cape Coast. Incidentally, today is his birthday. Happy birthday once again, Thomas. So today we're not looking at the clinical features of the condition. We're looking at this critical and pivotal intervention. In the 2024 budget, the government allocated some money to the NHIA to support kidney patients. The NHIA announced on the 1st of June that as part of its 25th anniversary, it's topped that up and is able to provide targeted support across targeted facilities for targeted age groups. That's what we're talking about. I know the association has responded, so we'll go straight into it. And good afternoon, Mr. Ahinkra.
Good afternoon.
Thanks for making it here.
Thank you.
We are most grateful, and I believe shortly Thomas will join us online. But you're welcome. You look well.
It's just by His grace.
By grace.
Yes.
Lenoni.
Lenoni.
Nuncho. Lenoni. Bonong. Well, we're grateful that you're here, and we want to be part of this advocacy drive. Joy News has taken it up. They've done the dialysis crisis. They did that interview and followed up on Priscilla, who sadly lost, and I know we've lost many others on account of the challenges with accessing dialysis. So can you start by telling listeners who you represent? I know there's the Ghana Kidney Association, there's the Ghana Renal Patients Association, and a few others. But when you say the Ghana Renal Patients Association, who do you represent?
Okay, we are a group of dialysis patients across nationwide.
Okay.
But the large number of us are in Kolebu,
Okay.
which we are normally about 400. Actually, the association has been there way back about 8 years now. Mm-hmm. It was when I went to Kolebu 2014, 2015. Okay. That was when the association was formed. So most of our leaders that were there have passed on.
Wow.
So we took it upon ourselves that, listen, hey, the association is registered, everything is done, the accounts, everything is there.
Okay.
And now we are having a lot of challenges. So I organized my people, let's pick it up. Let's start to do some advocacy.
Okay.
So that is where we started from. And then it became more vibrant when last year, Kolebu Teaching Hospital shut down for about 5 months because we were not having consumables.
Right.
So that was when we came into the limelight to start doing this advocacy. And today some results has come out.
Some results.
Yes.
Okay. Folks, if you just joined us, about almost quarter past the hour of 2 on Joy 99.7 FM, we're looking at and tackling the dialysis dilemma All right. Dialysis is an intervention. All right. If your kidney is, should I say, significantly compromised and unable to filter the blood of toxins, waste materials, and unneeded fluids, then you need, should I say, an intervention which filters the blood, right? And the system itself. There are two types, the hemodialysis and the peritoneal dialysis. They're different, but the most common is the hemodialysis, where you are connected, hooked up to a machine. Your blood is passed through that machine. It filters the blood and then puts back the clean blood into the system. Right? You can do this through the stomach walls. That's the peritoneal dialysis. Now, you require this depending on how damaged your kidneys are at a minimum of 3 to 4 times a week. You will be on dialysis for about 3 to 4 hours. So paying for dialysis is just a step or part of, should I say, addressing the challenges faced by renal patients, okay? There are those who have acute kidney injury and they may be on some form of dialysis, but for shorter periods, depending on their injury, okay? As we go along, getting the experience and the case really put forward by these patients, I will, put forward some additional information about kidney conditions and these processes. So that's what we're talking about. If you have any questions, concerns, you are affected or afflicted, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. So coming back to you. So you have a number of patients, the chunk of which, of course, are in Accra, and they depend on the Kolebu Teaching Hospital facility, right? Yes. Which was the facility in question when the shutdown came because of funds and a few other things, right? Yes. Currently, Kolebu is active. It's functional.
Yes.
All right. Okay. Now, let me say hello to Thomas if he's online. Is he online yet? No. Okay. Abeku is bringing him on, the birthday boy in Cape Coast. He himself also has been on dialysis for the past 11 years. I think, Mr. Henkra, you were diagnosed in 2014?
I was first diagnosed in 2014, but actually, because the education wasn't there, I didn't pay attention to it. So I think I stayed off for 1 year. So 2015, it hit me very hard. Okay. So
you stayed off treatment, intervention?
Not off treatment. Actually, like kidney, as you know, it's form of
99.7 FM.
Malaria.
Okay.
So I was just treating malaria, that kind of stuff.
Okay.
But before then, I have been told my kidneys were shutting down. So I need to go to Kolebu. But I didn't pick it up serious because I wasn't seeing any serious signs.
Okay.
Yeah. All that I was feeling, sometimes I feel a bit weak, a bit fatigue, that kind of thing. So I was not paying any serious attention to it.
Okay.
So until 2015, it hit me hard. That was when I was admitted in Kolebu.
Right.
So from 2015, September 29th, up to now, I've been on dialysis.
You've been on dialysis?
Yes, almost 10 years.
Okay. Listeners, we'll try and use the two gentlemen who are members of the Ghana Renal Patients Association as, proxy by way of, using their experience, the number of times they are going for dialysis, just to give ourselves some illustration, all right, so that we can all appreciate what we're talking about. Thomas is online now. Happy birthday, Thomas.
That's my brother.
Right. Many thanks for joining us on your birthday. Is that a white shirt you're wearing?
Yes, please.
Okay.
Today means a lot to me, and especially that we are having such a conversation.
Right.
Something that really we've been fighting and advocating for authorities to do a lot to save lots of lives.
Okay. Let me ask you, whilst today definitely means a lot to you, what about 1st June when this intervention package was announced by the Chief Executive of the National Health Insurance Authority, Dr. Abuaji Da Costa? Some say Da Costa Abuaji. But what did it mean to you when this was announced?
My brother, it really meant something good for me. It's something that we've been calling for and advocating for a long time, that we have the health insurance doing stuff like that. So when that announcement came, we saw and felt that some of the things that we've been raising. At least the authorities are listening. The only unfortunate thing is that as those of us who are in between or just below or above the age brackets that they announced, we were not captured or involved in that policy.
Okay.
But on the whole, I think that it's something good that we need to commend the NHIF for.
Okay. Right, great stuff, folks. We're talking about the dialysis dilemma with representatives of the Ghana Renal Patients Association. In the studio with me in Accra is Mr. Kojo Bafo Ahenkra. He's the president, leading the advocacy and many other things that are in their interest. You just heard on Zoom in Cape Coast, Mr. Thomas Khan. He's also a dialysis patient and a member of the association, and will be sharing their experiences, their, should I say, response to this package. He's already just set us off with some concerns. The package targets, should I say, the extremely at-risk groups, those below the age of 18 and those above the age of 60. The intervention is being rolled out across target facilities, I believe, Ho, Tamale, Efiankwanta, Kumasi, Komfo-Anokye. Have I left one out? Kolebu,
Cape
right?
Coast.
And Cape Coast, right? Kolebu has a slightly modified or varied intervention in terms of support because Kolebu already benefits from some key private donor support, and therefore that was varied. All right. So across the ages, the target groups 18 and below and above 60, the government through the NHIA says it will cover 8 sessions a week for these persons. Okay, I'll bring in the figures shortly, right? But 8 sessions a week for those who are under 18 and those who are over 60, right? This condition hits them particularly hard, so they were specifically targeted, right? So they are covered for 8 sessions weekly. The cost is there. And then those in the middle, 18 to 59, right? They will get 2 sessions, right, per month, okay? And this intervention, folks, covers 6 months. So it is good news, like Thomas just said, and I'll just confirm with Mr. Ahenkra, the president, in the studio. They have also welcomed this, but they have concerns, looking for a more sustained or sustainable intervention, yes, right, that covers them, should I say, in the long term. Okay, and that is spread across the spectrum. Mr. Ahenkra, nationwide, how many are you, at least in your association?
Actually, the data that we have is basically based on those who attend to the hospital.
So hospital-based, facility-based data.
Yes, because the point is we have a lot of them who are doing HERBA.
Okay.
Let's
talk about those captured under
the national.
Because the NHIA program targets those who are actually on national health insurance.
Yes.
Okay.
Yes.
And the intervention or the support is being rolled out through national health insurance.
Yes.
Okay. So
yes,
if you are not on this, you don't benefit. Oh?
Yeah, we have submitted a list to them.
Okay.
The patient that we have, like Kolebu, we submitted, Kipku submitted, Komfo-Anokye submitted, Efiankwanta submitted, who submitted. So it's based on the list that we submitted to them that this thing is being rolled out with, because that is the core that we have.
Okay. Let me also clarify for my listeners. Does that mean that you as patients or you as members of this association had some representation and therefore some input in the nature and should I say activation of this plan, this intervention?
Yes, personally I was there. I was part of the committee that was set up to look into it.
Okay.
I was there. I know maybe the next thing that might come about why this particular way of the way we did it.
Okay.
Actually, the money government gave to National Health Insurance was 2 million Ghana
2 million,
cedis.
yeah.
Yes. So when we sat down and we did the actuals, we realized that this thing will not even last for, I mean, if all of us being rolled into it, it will not even last for maybe about a month or 2. And then, so the point was the needy people. And I told them that anybody on dialysis is a needy person.
Okay.
So I brought in that any person on dialysis is a needy person.
Right.
Because like myself and Tom, 1110, we don't have anything. We've lost everything. Everything has gone into dialysis. So if you are telling me something is coming out and you say you are looking at the needy. So later what we came back was that let's look at the most vulnerable ones. And between me and you and Tom will testify, normally the children between the age from 18 and below, when they come, they don't last. And normally they need regular sessions maybe to clear their system. Yes. So normally when they come, within like between 2-3 weeks, a month or so, they are off. They die.
Right.
So I raised all this thing to them that if that is going to be the case, then let's look at them.
Sadly, Priscilla Santi falls in that group.
Yes.
And we lost her.
We lost her. Or because you heard the mother saying that they don't have money coming. Even they were doing once a week, which was not sustainable to the girl's health. So we sat down and I raised these options. And then when we came to the aged two, our fathers have gone on pension. They don't have money. Those things. So we look at all this, and most importantly, the numbers are not there.
Right.
The children and the aged, the numbers are not there.
Okay.
So why don't we then look at them most?
Okay.
So that was why we gave them
the
to
numbers
them.
are not there in the sense that they are not that many.
They are not that many.
Okay.
They are not that many.
Right.
They are not that many. So then why don't we look at them? And then we push National Health Insurance that, hey, if government has given us, why don't you also support us? So National Health Insurance, Mr. Aboti Acosta also did one or two things, and they were able to add 2.4 to it.
Making a total of 4.4 million
good
Ghana cedis.
Ghana cedis. So when we realized that the 2 million could have covered both the below 18 and aged, then we said, okay, let's give them the 8, because that one it will help them.
Let's cover them for the full 8 sessions. Their requirement monthly is covered fully.
Yes, but when you come to our side, we that will fall within the bracket between 19 and 59.
Right.
There too, we are the people who have the numbers.
Okay.
We are many.
You represent a higher percentage
of
those in need of dialysis. Okay.
So we realize that with the 2.4, if we say we are going to cover the 8 sessions, there and there again, it will last for just about 2 or 3 months, because that place, the numbers are there.
That covers only 2 sessions per month.
The reason why we came to the 2 sessions was that we realized that if we say we are going to cover all the 8 sessions for us, it was going to last for just about maybe a month or 2. The 2 point something will finish because we are many.
Right.
So we did then, we sat down, we do another actual.
So there was actually some compromise between the government and the government agency, being the Health Insurance Authority, and those directly afflicted, right? End users. Okay. And you looked at how you could get a longer duration of cover. And then for those who constitute the higher percentage of the group, you had to therefore agree to shorten or reduce the number of sessions covered to extend the duration of cover.
Because they were saying, they made us understood that, listen, the money is not there. For now, the budget has been read. They've done everything. So money will be difficult. So maybe they can go in for the mid-year review budget. If they go and they're able to get some money, then they will come back to us. We that we are having the 2 sessions.
Right.
If they're able to secure some money, they will come back to us to give us maybe either 4 out of the 8, or maybe they can give us 6 out of the 8.
Right.
So as at now, this is what we agreed on. That then because we're going for mid-year review, let's wait. They'll send a proposal again. If government is able to give us maybe something, we'll add up to it. Then this time around, it's going to be basically for we that we are between 19 and 59. So that maybe we can also get more coverage.
Great. 28 minutes past the hour of 2 on Joy 99.7 FM. Ultimate Health with me, Nortey by nature. We're looking at the dialysis dilemma. We're trying to dissect it into its, should I say, lowest basic common denominators. With the president of the Ghana Renal Patients Association, they are properly and formally registered. They've been in existence for several years. A lot of attention has been focused on their, should I say, concerns and the crisis. Okay, so today we have them and we're looking at this from their viewpoint. You just heard speaking the president, Kojo Bafo Ahenkra. On Zoom, I have Thomas Khan. He's in Cape Coast. Shortly, he will give us the picture of what is going on in Cape Coast in terms of whether they are benefiting, whether it has actually started. In Kumasi last week, we had some, should I say, concerns. I wouldn't want to call it agitation, but Comfort Nortey had some crash meetings to discuss the modalities and certain things impeding the effective implementation or takeoff of the program. Indeed, there were some voices that Joy News captured of the concerns of some patients in Kumasi about the 18 to 59. We're talking about ages and how they are covered in this intervention. Let's take a listen to one of them, Letitia, I think Edu Boahin, speaking to Joy News earlier last week.
Now, what kwa middle no just 2 free session in a month no how you understand.
I know the share mopa because me am it way me 3 times a week. It is a 2 2 per day na one boy it's okay omo do me there no mo fe bi enka ye ho ye share o mara. The culture government say why are there but yeah ye middle no your dem no emboaye.
We plead for government's intervention. It is very difficult to make payment for dialysis treatment, especially for us who fall between 18 to 59. I am making a plea to government and the National Health Insurance Authority. It is not easy for us. We are really finding it difficult. Our helpers are running away.
Because if you move for say anka eba ni into oboa kakra ka obeye okay but oboa wa kwa echira onu so ye nipa na ho aye no ahomte
this ready ma ban ni NHI ni nyina yesen
ma this ready ma ban ni NHIS say omadum ye yese wo mo ya ye falling in the middle no omundum ye no mo fa binkan ye ho na ye kasa wa ya de enso ono so mo no ho so kakra mai
but you need the same
your family to share Dubai.
Joy 99.7 FM.
Welcome back to Ultimate Health on Joy 99.7 FM. We're tackling the dialysis dilemma from the, should I say, viewpoint and experience of the Renal Patients Association of Ghana. Their president, Mr. Ahenkra, is in the studio, and Thomas Khan is on Zoom speaking to us from Cape Coast. Let me swing to you, Thomas, and let me also at the same time announce our WhatsApp. I'll read out a couple in a sec. Well, government has, should I say, responded, and the National Health Insurance Scheme has also topped up to give you some benefits. What's the situation in Cape Coast? Can you confirm whether renal patients in Cape Coast have started to benefit from this package?
For Cape Coast, the patients here started enjoying this free dialysis policy just from last Friday. Just last Friday.
Okay.
But before after the announcement, it had to take that longer days for the hospital to roll out that intervention. And what we gathered was that the management of the hospital or the unit, the dialysis unit, were yet to get official communication of how we were going to roll out the policy.
Okay.
But again, like you rightly said, for now at the Cape Coast Teaching Hospital, it's only those 18 and below, and then 60 and above who are enjoying.
Okay.
And then for those of us in between, we are yet to even have a conversation about how we are going to get the supposed 2 sessions out of the 8.
Okay, Thomas, let me just get some clarity. So what you're saying is that the vulnerable groups, 18 and below and 60 above, have started since last Friday.
Yes, just last Friday.
Just last Friday, right?
Yes.
Friday.
But unfortunately,
Friday was the 7th.
Unfortunately.
Hang on. Friday was the 7th. The program was announced on the 1st.
Yes.
Okay,
Yes.
so that's not too bad. They have started to benefit,
Yes.
but they represent
Exactly.
a smaller number of those in the central region
Yes.
or those attending
Yes.
Cape Coast Central Hospital.
Yes.
Right.
Yes. And then when you come to the Cape Coast Teaching Hospital, we don't even have one single person who is 18 and below. So
Okay.
it's just a handful of a few patients who are above 60 and above. So 18 and below, we don't even have a single one.
Okay. Thomas, give us a picture. How many of you are attending dialysis or the renal center at the Cape Coast Teaching Hospital?
Well, we are just about a total population of about 50 patients.
Okay.
And just about 10 or 12 60 and above.
Okay.
So the rest of us are in between.
Okay.
We are the ones who were exempted.
Right. How many sessions do you do a week, Thomas?
Twice a week.
You do twice a week. So
Yes, please.
should that program or the package roll out for the intermediary group 18 to 59, then that would very much cover you, right?
Yes, it will cover me, but still, we will still ask for more.
Okay.
Because in a month you are doing 8 sessions.
Okay.
So if that program comes up and then
So a quarter of your sessions are covered. So you pay the rest out of pocket. 2 out of 8.
Exactly.
Right.
Exactly.
Okay. How much do you pay per session?
Yes. So now Cape Coast Teaching Hospital, like the other hospitals, it was increased to 491.
Okay.
But at the Cape Coast Teaching Hospital, the hospital authorities have they say they have waived of some of the cost, so they make it 490 instead of 491.
Okay. Right. So
yes,
you have to pay 491 times 3, right?
Exactly.
And then you have times 6, huh? Mm-hmm. And then you have 2 sessions.
Yes.
Which is
for
about
free, that's
900 and something covered for you, right?
Exactly.
So
yes.
You have 982 covered for you per month, but it has not started in Cape Coast Teaching Hospital yet.
Yes.
All right.
Yes, it has not. It has not.
Okay, right. Just quickly for the benefit of listeners, right? For children below 18, the program and the intervention covers 8 sessions free. That is dialysis. Please note, it is not only dialysis they pay for, right? It is not only dialysis they directly pay for. So that will come to 3,928 per child per month. Okay? That's for the 18 and below. For the 60 and above, they also get the same 3,928 paid for by this NHIA package per month. Okay? Those who are 18 to 59, they are getting 491, 50% of the 491 free, right, for 2 sessions.
Yes.
Okay? Which essentially is 2 sessions free for what they require monthly. Okay? Kolebu is worked out differently because they already benefit from, let me call it, a private donor, right? We've hosted them on this program before. The First Sky Group do a lot of awesome, wonderful work in Kolebu, right? So that's why the Kolebu program is somewhat different. Mr. Ahinkra, let me just quickly come back to you. Abeku, can I read a couple of our WhatsApp messages? Let me quickly come back to you. This is the situation in Cape Coast. What can you see about the rest of the country? Has this package been fully and properly and smoothly activated?
Yeah, per my checks from Kumasi, they also, actually, the 1st June was a Saturday.
Yeah.
So I think the publication came out on Monday.
Okay.
Yes, that was when the whole thing came out. And I always use Kolebu as an example because I am in Kolebu. Kolebu for the first session, it started at 3 a.m.
Right.
3 a.m. And normally, you require your receipt before you go.
3 a.m.
3 a.m.
Right.
Yes,
The dialysis center is open, and so the first patients for dialysis.
Yes, we have 4 sessions.
Right.
4 sessions in a day.
Right.
But because you don't have enough machines,
Okay.
you have to start early so that the other sessions can also benefit.
Okay.
So the first session will start at 3 a.m.
Right.
So the 3 a.m. you need to produce your receipt before you put on machine.
Okay.
So
Receipt
normally
showing and confirming you have paid for the procedure.
Yes.
Okay.
So normally those going for the first session pay like those who be going tomorrow.
Right.
They have to go and pay this morning, this evening.
Cash.
Or cash. We have some banks in Kolebu where
Yes.
we pay.
Okay.
Or at that time, normally the bank work 24 hours. The banks.
Okay.
They work 24 hours in Kolebu. Or you go early, maybe around 2 a.m. to go and pay before you go to the center.
Okay.
With your receipt. So on the Monday, when the announcement came, at least for the first session and the second session, they've already paid.
Okay.
They've already paid.
They had paid in advance of
in
this
advance.
announcement.
Yes, but on the announcement.
But there was an announcement following that suggesting that they will get a refund in terms of covered sessions.
Yes.
Okay.
Because I think the whole of the Monday, anybody who went for the dialysis session paid. And for Kolebu, they were saying that they've heard the thing, but they don't have any official communique.
All right.
So they cannot say.
So until they receive that official notification,
yes,
you will continue to
they'll
pay.
continue to take their money because it's a hearsay.
Okay.
So they don't want to commit themselves.
All right.
So I think the Monday, Tuesday, the payment was going on. But the Tuesday, Dr. Da Costa came to Kolebu for a visit.
Right.
I was there with him.
Yeah.
So it was there he
And
made
Professor Boima.
Yeah, and Dr. Boima and
Right.
yes, I was there with them. So it was there he said that, listen, that thing has started. So anybody who has paid will be refunded. There will be refund for anybody who has paid.
Okay.
So, and he begs Dr. Boima that they should not collect money from anyone again, and that they should allow the children and the agents to do, and we in the middle they should allow us to have our 2 free sessions.
So what does that mean operationally or practically on the ground? Do you need some kind of cheat, some kind of notification? Because you needed a receipt to access dialysis. Now, the NHIS boss visits the facility and said, go ahead and give them this critical service. How was that supposed to be done? How did you understand it as renal patients? Is it that you get some document or paper that the center will now receive?
In fact, I suggested to Kolebu Rena that, listen, in order to make it a uniform,
yeah.
why don't you take maybe like the 3rd week of the month? Already, I think we are in the 2nd week.
Okay.
So why don't you take the 3rd week of the month and announce to us that this particular week, those who are doing the 2 sessions, come and have your 2 sessions, because normally all of us do twice a week.
Okay.
So what? Made an announcement or tell us or inform me. I'll tell my people that, hey, those of us in Kolebu who are enjoying the 2 sessions,
Okay.
maybe this week when you are coming, when you go, don't pay. You are going to enjoy your 2 sessions so that it will be uniform. But when you leave it open, maybe today I have money. When I go, I'll pay because I have 6 sessions more to pay.
Okay.
So
you want the exemption on the other 6?
On the other, so
right. Did this work? This.
In fact, the whole thing will start coming tomorrow.
Okay.
Because the letters and everything came out officially between Thursday and Friday.
Okay.
So I think now the modalities are being put in place.
Okay.
So I'm sure from tomorrow something like that will work because I think for the aged and the kids,
right,
it's the rollout is working.
Okay.
Because they don't have to pay.
Okay.
But we in the middle that we are supposed to have only 2 sessions.
Right.
I think from tomorrow these modalities will work.
Okay, folks, if you just joined us, it's 43 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. We are dissecting the dialysis dilemma. Basically, we're looking at access or financial access to dialysis, a critical intervention procedure for those suffering from chronic long-term kidney disease, right? And we have a challenge in terms of, or with regard to the number of active centers and facilities, the number of dialysis machines that are active and functional. But an intervention package has been offered covering the next 6 months by the NHIA, and it targets those under 18 and those over 60. And then there's an intermediate program for those between 18 and 59, right? If you have any questions, concerns, WhatsApp 055 11 11 997, telephone number 030 221 6541, and we'll be able to take your questions, concerns. In the studio with me, Kojo Bafo Ahenkra. He's the president of the Ghana Renal Patients Association. And on Zoom is Thomas Khan. He's also a dialysis patient and a member of the association, giving us the picture from Cape Coast. So we will welcome your WhatsApps and your phone calls. Oye Inafienya, I see you. And this is, government's current, let me call it short-term intervention. The association is pushing for more on the basis that there are more numbers requiring this critical, life-improving procedure. It is not, a cure. Okay? It is filtering, the blood, which cannot be filtered by your kidneys. So phone lines activated, WhatsApp is also active. Mr. Ahenkra, so you issued a statement. You're happy with this. You were part of the process. So this didn't come as a surprise. You knew what was coming. Generally, the response of your members has been, praise God, but can we have some more? Right? We are aware of the economic situation the country is in. Okay. Is there any ongoing or further discussion with regard to financial access to dialysis?
Thank you very much. Yes, the committee that was set up, actually, it was chaired by Dr. Nsia Asari, the Presidential Special Advisor on it. It was chaired by him. And we had a lot of deliberations. We had a lot of talks. So we suggested to them that why don't we get a board to set up a fund, so that government can put maybe a seed money in it, and then we can write to corporate Ghana. We can go to, the big companies, Talo Oil, Newmont's Ghana, for them to be putting some fund.
So we set up a fund, right? And a board for the fund.
Yes.
Okay.
So that we can start raising some funds. Into the fund.
Right.
We can write to corporate Ghana, the big companies, individuals, anybody who wants to put something into it. It was and then secondly, we're also looking at, why don't you have like organ bank?
Right.
Ghana road accident is about 70% or something. People do die quickly, and some of them, when they do get this thing, we normally get some of their kidneys, their liver, and other things. We can use them. We can use them. So we suggested to them that if any form of legislature or something can be drawn to Parliament for that organ bank to be established, so that when maybe an accident happens and maybe the person is dying.
I think Dr. Da Costa alluded to this and the need to push such a legislative document
through
the process to address that.
So we suggested all those things. So Dr. Nsia Asari understood that he made the presidency look into it. Then maybe we'll come back, look at the modalities, the way we can go about it. So it's something that we're looking for. That one, like in other countries, maybe in the States, you don't stay on for dialysis for a long time because they have that kind of policies. Once they get a kidney that matches you, transplant is done for you. You are off dialysis machine.
Right.
So we are looking at those ones too.
Okay. 030-221-6541. 030-221-6541. We're looking at financial access to dialysis. And also, what the long term looks like. This definitely looks short term. Some people say even knee jerk, and they have other not too polite descriptions for what is going on or what has been provided. Definitely, it is better than nothing.
Sure.
If you have any concerns, we can look at that. I have this one which is asking Nana in Spain text. Good afternoon, Nortey. Hope you're well. I'm well by grace. Why the surge in kidney failure in our country? Must we relook the many herbal products on the market again? Well, there are concerns there, and that's why I said and emphasized today I'm not looking at the clinical picture and some of those. But mind you, apart from the products we take, a lot of chronic kidney disease and a lot of impaired, or should I say kidney injury, is also on account of the high numbers of hypertensives, diabetics, and so on and so forth.
Yes.
Right? So you need to be mindful that there are other things damaging these organs or compromising their function. I have somebody on the phone line. Hello, good afternoon. Hello, good afternoon.
Yes, good afternoon. My name is Koku. I'm calling from Kaneshi.
Right, Koku, you're welcome. Share with us.
Thank you. So quickly, it's a good step because, like you said, it's better than nothing. But what about we could have reduced the cost to make it accessible to more people? And, in economics or in numbers, sometimes when you have more, it helps pull more funds because the facilities must be, should I say, maintained. So why not reduce the cost? Because 2 free sessions, you still have to pay the high cost for the other 3 or the other 4. It's 6 sessions, right?
That's right.
So, then it's like robbing the left to pay the right. So I thought that maybe we could have even kept it where it was to allow those who are accessing, or maybe reduce it a little more so that more people can come on board. This is in pricing theory, these things are done, and it rather brings on more people and more funds so that the system can be kept going. Because putting it on the NHIA, it still will have to be paid for somehow. How is it going to be paid for?
Right.
So, and also bring in more machines. We are able to do that. We get money for V8s and stuff. Why can't we bring in more machines?
Okay. Great.
So that people don't have to queue.
Right, great stuff. So
thank you very much.
Bring in more machines, make the cost or the price more reasonable. Let's not forget these machines cost money, and there are other inputs and materials. Okay, this is support going directly to the end users. Okay, so we're looking at their ability to access the procedure. All right, and so I've read a lot and I've talked to the clinicians and other managers of the system. The tinkering we can do with costs is subject to the economic situation we are in as well. Our city is not faring that well, and so these are things, but very, very, very bright inputs there. Phone line is still active, 030-221-6541. We're trying to bring Thomas back online. Okay, we had to reactivate the Zoom session due to a small technical trip. We'll get him back. Phone line is active. WhatsApp 055-11-11-997. Right. So, Mr. Hankra, so these are suggestions. Is your association engaging bodies like Parliament, Association of Industries? These key focal points when it comes to raising funds, when it comes to pushing legislature or law.
Thank you.
Sorry, just before you answered that, I needed to put this in as well because I've put the clinicians aside for this program. He mentioned the organ donation law and the legislation. For a lot of people, they will need, require what we call kidney replacement therapy or transplant. Okay? So you have to have the kidneys first and foremost, and you need the capacity to do these transplants. All right? Because we don't have that many donors, that is not a huge percentage of the modalities that we're running now. Okay? So that is why there's a huge chunk of pressure on dialysis. Dialysis is not a treatment, it's not a cure. It's supporting your kidneys, whether they failed or they are significantly compromised. All right? So let's understand that. That's why Mr. Hankra, in response to my question, brought up kidney transplants, okay, of which we're not able currently to meet the numbers, okay? So once we have a law that allows us to, in a sense, let me use that word, harvest organs and then get a stock of organs that we can now match to recipients, then we'll be doing something else. I looked at the percentage, I've lost it off head, but there's a very small percentage of people who receive transplants. All right, and we need to look at our capacity to do that, and of course harvest the needed organs. Yes, you were coming in with a point.
Yes, like the last caller said, I mean, we don't have machines. Let me hammer on that, please.
Right.
We don't have machines. Kolebu machines working is about 13 to 14.
And we are still not doing that much by way of percentage of the peritoneal dialysis.
Personally, I have read about it. I've not even seen it being done in Ghana.
Okay.
Yes, so
Right.
mostly the hemo that we are doing.
Hemodialysis.
And then we don't have the machines.
Right.
We don't have the machines.
Okay.
The machines that we have are inadequate to support the kind of numbers that we have.
Okay.
We don't have it. So rightly, we need the machines. And then he also said about looking at the price. Yes, because like I said, the data that we have is based on those who come to the hospitals. Now, in Accra here, we have about 15 to 16 private dialysis centers.
Yeah.
And all of them have their patients. Now, this thing that is coming, if let's say, I mean, God willing, when they go for the mid-year review, and God willing, we are able to get some money to come and support we that we are in the middle age, I'm sure anybody outside within the private sector would like to join Kolebu and enjoy the free dialysis.
Right.
So, like the caller said,
So we're going to see or witness some migration
big
of
time,
those
big time.
doing their dialysis in the private
Privately,
sector.
joining-
Once the public sector
Yes.
is subsidized, then there'll be migration.
Migration,
Right.
big time. So we need to get the machines. The machines needs to be there. Available machines needs to be
Does
there.
the talk about legislature, organ donation, raising of funds, the cost, and so on, does it include building capacity with regards to machinery, personnel?
Yeah, we raise all those issues there.
Okay.
We raise all those. Like once again, the committee that was set was made up of the CEOs of all the hospitals.
Okay.
Yes, they were there. So they all allude to what we are saying. The
Okay.
machines are not there. Cape Coast is doing about, I think, 5 or 4.
Okay.
Kolebu, we are doing about, I think, between 10 to 13.
Okay.
Comfort recently, somebody just went to donate 2 machines to them. Before then, they were doing 1.5.
Okay.
Yes. Tamale, I think, is doing about 3 or 4. If you're Kwanta, I think it's about 2 or 3.
Right.
Yes. So the numbers are not there. And then that is why most of the people don't even go to the hospital, because you go and queue. Kolebu were queue some time ago. You can be there 2-3 days.
Queuing for dialysis.
Yes. Some time ago, I think about 3-4 years ago. But now it's a bit better. It's a bit better now.
Wow.
Yes, because even there, the machines that we are using now, I mean, let me say this to Kolebu, and let me praise Kolebu for this. I mean, the machines that we have is the Physionos, the latest machine that we have, and is doing a very fantastic job. I mean, when you go around, the nurses, the doctors are on point. That one, I give it to Kolebu.
Right.
I give it to them. They are on point. Everything is perfectly there. But the point is, sometimes when you overuse the machine would, because it's computerized, it will
Right.
tell you, I'm tired, put me off.
Right.
It will write, I've worked for.
It's programmed to take a break at certain
Yes,
points. Otherwise, you're compromising the
Yes,
machine.
it will tell you I've worked for something hours. I need to go off. And you have no choice to put the machine off.
Right.
Maybe at that particular hour somebody might need dialysis.
Okay.
You see, so we need to get the machines, we need to get the numbers in, and then the fundraising issue that we are talking about.
Okay.
I'm hoping the committee will meet as early as possible.
Right.
We'll look at it quickly so we can start, because 6 months is just around the corner.
Definitely.
After 6 months, what next?
Okay. I've heard Kofi Sapon Asiedu of the CDD suggesting that by his calculation, we need 7+ million Ghana cedis based on the figures and the numbers he has, should I say, used in his analysis. So we definitely need to look at that. This one says, regards and kudos to Mr. Henkra. Keep up the good works you are doing. Nortey, this man has been encouraging to me ever since my mom had to start dialysis at the Bank Hospital. Thanks, Kojo. It's me, Ode. So this is somebody giving you the thumbs up. We've had to switch Thomas in Cape Coast to the telephone lines. I'll take, should I say, key requests from the two of them to the corporate world out there and to government. So Thomas, if you can hear me. Hello, Thomas. Okay, looks like I don't have him. But Mr. Ahenkra, we have a few, well, we're almost out of time. But what are the key things you want government and corporate, should I say, the corporate world to do for you? What kind of requests do you have to put out?
Okay, thank you. One, I would like to thank government for so far the initiative they start. They made us understand it's a start. Really appreciate what they've done, but like you said, we need more. We need more. And then secondly, about the machines, we beg corporate Ghana, if some individuals out there or companies there can get us more machine, it will help us a lot.
Okay.
And apart from that, like you said, it is not only the dialysis that we do. We take injection, erythropoietin. We take it.
Yeah.
We buy them. We take. We do labs. Ideally, every month you're supposed to do our labs too. Is not less than 500 and go.
Right.
We do those labs. Apart from that, we do medications. Ideally, when you're on the end stage, you're supposed to be on a special diet.
Right.
But because the money is not there, we take what is available to us.
Right.
So we are appealing to corporate Ghana. This organization is registered.
Right.
We can put our account numbers out there.
Right.
If they can donate something small to, so that we can use to be doing our labs and that of our injection and those things.
Okay.
So these are the appeal we appeal to the general public that we need their help.
Okay.
Yeah.
We will, should I say, undertake to partner with you. We could also consider a follow-up program next week. I still would want to do a bit more education on kidney disease itself with some of the clinicians, but definitely we have to come back to this. Dede is saying that one cannot just harvest someone's organ upon their death. That victim should have signed documents to be an organ donor upon their death. Legislation by whoever does not cut it. I disagree, Dede. That is what the legislation empowers you to do. The same way we are actually factoring or forming our own legislation when it comes to reproductive health, IGF, all those things, right? And so on. So legislation would allow you now, Dede, if you are in Ghana, to sign a document that can be activated under that law. So it's not a wholesale legislation and then we just go harvest, all right? So that is why I disagree with you. But your point is well clear. Okay, we're not just going to harvest parts. Otherwise, then we'll have body parts galamsey. We don't want that. Thank you, Dede. Love you to bits. This one says, William from OEB. Let me quickly clear this. Thank Nortey for bringing the issue of kidney patients to the fore today. Let's have another program to educate Ghanaians. It's scary. We need a lot of education on this disease. Good afternoon, Joy FM. This is William from OEB near Dodowa. I thought I saw something else. This one says, good afternoon, Nortey by nature. This is a very insightful and welcoming program, but is it for political gain or just one day show? Why do we have to wait for somebody to die before we do the needful? K Danso somewhere in a Fenya Mataheko. Right, K Danso, I put in there someone to die. I think that's what you wanted to type. But basically, he's saying, why wait all this time? And maybe we should be doing things proactively and looking at some of these things. What we can do to prevent the condition is one side of it. And also what we can do for those affected and afflicted is the other side of it. Thank you, my late comers. I know you're there, Ultimate Health family. So it's coming in. Do I have any more? No. Dede is typing. I know she wants a debate. But that's what the legislature, a law would actually allow you to do. There are people who actually want to donate their bodies for medical science, for donation and so on and so forth. We need to straighten the terms and the paths by which you can do that. Okay, you know our culture and our tradition. Families will fight you. But if Mr. Ahenkra and Nortey have written, and what they have written is identified and recognized by law, then a process will be set in place to activate that and make it manifest so that we can save lives. Okay, forcing people under duress to sign documents to harvest organs. There's nothing about duress here. Okay, that's not what we said. Okay, we are looking at a law that allows people to donate. Some travel to India and other places and are able to benefit because there They have a streamlined process, okay? But I'm sure we can continue this, and we will definitely do that next week. Mr. Hankra, I'm so grateful. We haven't touched even what you go through during dialysis. It just sounds like you press buttons and then people walk away, right? There's a lot involved that we haven't covered, and we'll try and do that with the association and other associations. Prof. Samuel Entry, Dr. Charlotte Osafo, and all those. I know you are out there. There's a reason I focused on the Renal Patients Association today. So we'll bring you all in. Prof. Vincent Boyma, hey, you've been doing this for a while, right? And we need to get you all to give your input, at least on radio. I know you're already doing it on other platforms and with the, should I say, activating agencies. Dr. Da Costa, I salute you, but you know, when it comes to NHI, I have loads of questions, not just renal questions. Once again, thank you, my listeners. Many thanks. Abe Kusa Kofi, my producer. Last week, he was under the weather and busy elsewhere, so we had a bit of a bumpy ride, but he's back. And he's well. He tells me he's well, but sometimes he doesn't tell the truth. I need him to rest. Stick and stay on Joy 99.7 FM. My name is Nortey by nature. Thanks to you, my discerning listeners. I'm out.